Good morning and welcome to the University at Albany Center for Public Health Preparedness Grand Round Series. I'm Elisa Streeter and I will be your guest moderator today. Now, before we start, we would like to ask you to please fill out your evaluations online. Continuing education credits are available after completing the post-test, and your feedback is always helpful to the development of our future programs, so please do that. We also encourage you to participate today, and we will take your calls later in the hour. The toll-free number is 1-800-452-0662. You may also send your written questions at any time by fax to 518-426-0696 or by email to the address on your screen. Today's program is Bridging Community Partners Through Drills and Exercises. And our speaker today is Eileen Scanlon. She's a public health nurse supervisor at the Nassau County Department of Health. And thank you for joining us, Eileen.
Thank you for inviting me. I'm happy to be here.
Well, we're thrilled to have you. Very interesting show ahead of us. Let's talk about, what do you mean by bridging community partners, and what are the learning objectives there?
In bridging community partners is you have to bring the community into public health. You have to sort of bring them into the fold. And we do this through training, exercising, educating our community partners. Some of our learning objectives today is recognizing the need to collaborate with the community partners in preparedness, develop strategies to engage community partners in planning, identify lessons learned through drills and exercises with community partners, and describe the value of a health and medical multi-agency coordinating group.
Now, why is collaboration there the key element?
Because everybody, especially in an emergency, needs to be playing together. We all need to be working together for the good of our communities, and that's the importance of collaboration.
How do we define community partners? Who are they?
Community partners are faith-based organizations, are civic organizations, are first responder organizations. The people that make up the community are really what our community partners are.
Do they include state agencies? What about them?
Yes, they can include state agencies. New York State Department of Health is a great partner of ours at the local Department of Health. We work with Department of Transportation when we work with them when we do the logistical movement of some of our materials. So many different agencies, even some of our local towns and villages and school districts, they're all part of our community.
What are the missions of all these agencies? I mean, what are you looking for?
I'm looking for the missions, and most of them is for the good of the community. Most of these community-based organizations are there to help the community. So it's just such a natural fit for them to work with us in public health initiatives.
So why is knowledge of the community so important? Why, obviously, these agencies and the people you're working with need to know these communities well.
Right, and that's one of the reasons why we look to the community-based organizations. Perfect example, when we look to care for special or vulnerable populations, I look to a lot of the agencies that's their mission, because they know how to access them and how to care for these vulnerable populations better than we do.
How do you develop then these partnerships?
What we do is we look to assess what's out in the community. What kind of community agencies are out in the community? Then we look to join them. We collaborate with them. We go to their meetings. We participate in their activities, and then we ask them to participate in ours.
Okay, let's look at some real life examples, senior citizens, or what are some of the real life examples that you could give us?
Some of the real life examples, back in 2004 when we had the flu vaccine shortage, we did a huge influenza pod with the senior citizens. The senior citizens groups helped us. Senior Citizen Affairs for Nassau County was one of the lead agencies, and we all collaborated together, and within 2 days we were able to vaccinate 8,000 seniors. That was one collaboration. Another collaboration is we work with Catholic Charities down in Nassau County. That has helped us with the seniors and the vulnerable populations in setting up special needs shelters.
Are you recommending then that members of our primary audience, whether they be public health workers or physicians, join these community-based organizations?
Yes, they can join the community-based organizations, or they can join what we have in Nassau County is the Medical Reserve Corps, which we look for licensed healthcare physicians or somebody with special skills. And anybody other citizens that do not belong to our community-based organizations, we have our CERT team, our Community Emergency Response Team, that they could also join.
So you're recommending, I guess, a couple ones in particular. How do we go about then assessing the needs of the community?
To assess the needs of the community, you really have to get involved with the community organizations. What do they need? What is the population in the community? A perfect example is when we plan for hurricanes. We need to plan to be able to shelter our vulnerable population and also be able to prepare our vulnerable population. We work with senior citizens groups. We go out and we do educational programs on personal preparedness.
So some of these sites include these alternate care sites. Tell us a little bit more about these alternate care sites.
Alternate care sites we're looking at in the event of, I'll give a perfect example, pandemic flu. Suppose we have a pandemic flu and we really don't want to overtax our hospitals. We would look to set up alternate care sites in the community where maybe we can set up a little fluid and hydration and do a little education so that people would be able to care for themselves at home, because the hospitals are going to be far too taxed to be able to take care of some of our communities. So that's why we're looking to put together alternate care sites.
These alternate care sites must need a lot of personnel. How do you go about training this personnel?
Correct, they do. We need a lot of personnel, and that's why we've gone out to the community-based organizations. We put together educational programs. We have partnered with NYSIPSI, the New York Consortium on Emergency Preparedness Continuing Education, which also is with VEEB. VEEB is a part of it, our Vocational Education and Extension Board, which has the EMS Academy, that has helped us put together training programs on point of dispensing, special needs sheltering, that we've then taken it out to the community and put together first a lecture series and then an actual exercise where we've actually brought the community in. The community is not going to buy in unless you put the time in to be able to train, educate, and exercise with the community. They need to feel that they're a part of this public health initiative.
So they need to have that training. And in order to do that, that's a whole lot of coordination to get everybody trained, to get these pod sites up and running. Who coordinates these?
Coordination is basically done through the health department. We do a lot of the coordination, but again, with the help of our partners being NYSIPSI, VEEB, EMS, everybody coming together to be able to put these programs together. And it's a true partnership.
It sounds like it is, and I know you've said before how important it is for all these groups to work together. Some of these names, NYSIPSI, tell us a little bit more about who they are and what they do.
NYSIPSI is a consortium of educational schools, Columbia School of Nursing, Kansas, University of Kansas at Wichita Medical School.
We're talking across the country.
Across the country.
Yeah.
Albany School of Public Health, VEEB, Vocational Education Extension Board, their EMS Academy division. They all come together and they just bring so many different forms of expertise to help us put these programs together. Just a perfect example, we just put together a Medical Reserve Corps symposium in November, and they all came together to help us with that. University of Kansas, one of their expertises is evaluation. They put together all of the evaluation tools that we use in all of our programs. Columbia School of Nursing helped us put together a lot of the educational programs. And VEEB, the Vocational Education Extension Board, helped us present it. So it was just a lovely marriage that really worked. And Albany School of Public Health provided all of the CEUs for us. So we couldn't have done it without all of us working together.
That is a huge collaboration, and it's why I think your program has been so effective. How do you take that to the next step? Somebody's trying to create this or this collaboration. How do we take this to the next step?
You need to check your resources. And that's just so important because public health can't do it alone. We need the resources. We need the resources in the educational avenues. We also need the resources in the community.
All right, I think we wanted to talk a little bit about your specific situation, describe for viewers, the staffing ratios first. Why don't we talk about that, and then we can get on to how you managed that to work in your own specific situation. How do you get the staff per client ratio? How do you know how many people you need in these alternative care sites?
It's an interesting on the staffing, and that's what's a little bit scary in public health because we do need a lot of staff to be able to accomplish our mission to be able to help the community. For example, in a special needs pod, we need 44 staff per 100 clients, which is really, it's very, very tight because these are special people that are coming through there. We need to give them more help. Whereas in a regular pod, it's 56 staff per 300 clients. So look at the difference in the ratio. It's huge.
That's a big difference.
Yes.
So you have to get a lot more staffing and train differently for special needs clientele.
Train much differently for special needs clientele. That's why we look to the community-based organizations that really deal with our special needs populations.
And now we want to look at Nassau County because that's where you have made this work. Let's look a little bit about the demographics there.
Nassau County is a very interesting county. We're very, very densely populated. It's 1.3 million people. Our proximity to New York City it's a 30-minute train ride. I can get on the Long Island Railroad and I'm into the city in 30 minutes. We have one of the largest commuter populations into New York City. It's also, we have 71 volunteer fire departments, EMS. We have 56 different school districts, 3 different towns, 3 different cities. We have over 50 different villages, all living within Nassau County in this small area. So it's very governmental in that it's a home rule, so everybody really manages their own. So you need to bring them all together to be able to work with you. And that is a challenge, but a challenge that I think we've done really well with in Nassau County.
Is that your greatest challenge? I would think also all of the cars and the parking, when you need to find alternate care sites, those kinds of things must be a huge challenge.
Huge challenge. When we look at putting together points of dispensing or special needs shelters or alternate care sites, we look at the different sites before we actually say, okay, this would be good. We need to have parking. Long Islanders are in love with their cars. So we need to make sure that we have adequate parking, that easy accessibility, friendly environment. These are very important because during any type of a public health emergency, we want the citizens to feel very comfortable to be able to come here.
How do you then assess, now you've got these organizations working with you, how do you assess that they're really committed to this? Because you need that commitment to make this work. This is huge.
You need the commitment, but you get the commitment and the trust when you show as public health that you're willing to help them by the training, the exercising, belonging to their meetings, coming, being a part of their community, as well as asking them to be a part of your public health community.
And that's how you get them to buy in?
That's how you get them to buy in. The biggest thing is the training. The training, the education, and the exercising and it's time consuming. But public health needs to be able to do this. Otherwise, you're not going to get the community to help you.
All right. If they don't feel like they're ready to do the job, they're not going to show up to do it.
Correct.
Okay. Once you form this group, you've got this group formed, how do you then take it to the next step and you make sure that they're ready to go and that they're there when you need them?
I'm going to give you a perfect example of what we did in August. In August, we did a special needs shelter training. I went out to, we held it in Holy Trinity High School, which was a diocesan high school, which we partnered with Catholic Charities on. And I said, you know what, this shelter is in the community of Hicksville. I said, let me go out to the community at Hicksville at large and see if I can get their organizations to sort of adopt this shelter. And that's what I did. I went to the Civic Association meetings, I went to the fire department meetings. Catholic Charities took it to the local parishes to ask them to buy in. We sent out flyers in order to get the community to buy in. It wasn't easy, it was time consuming. A lot of the community meetings meet at night, but I made it my purpose to make sure to go out to the community to get the buy-in. For that shelter training, we had 150 people come for the shelter training.
Were you surprised by that?
I was surprised, but it was really good that the community really came out. And we only did the one training. It was August last year. It was sort of towards the end by the time we got this up and running. But it just gives us impetus because we're going to keep doing this.
Right. Now you know. So now how are you going to coordinate that, though? You're going to go to the church halls, put up the flyers. Once you get them, how do you get them all in that space at the right time?
We set up a time. What we did was we set up a time. We had Holy Trinity High School. We did a training the week before with the Red Cross where we did general shelter training. And then the following week, we did it on a Sunday, which was a little bit, we didn't really want to interfere with anybody's other activities or anybody's work schedule, so we did it on a Sunday. We provided food. We make sure.
Very important.
Very important. You need to provide the food.
Food and drink, so
Right.
welcome, yes.
We provided breakfast, we provided lunch. And then on that Sunday morning, everybody came in and we did a lecture on exactly what a special needs shelter was. And then after the special needs shelter lecture, we actually went into the other part of the school, which we had set up as a special needs shelter. We assigned roles, which we had taught during the lecture series, and then we actually put these roles into action.
So you have these different roles, and how do you know though? How do you know who's going to take on these different roles?
It's interesting. Sometimes what you'll do is you'll ask for volunteers. When we do our training, we actually give them a book. Everything that we're going, we give them a copy of the slide set, plus we give them a copy of the plan. Like we gave everybody a copy of the special needs plan. We gave them copies of the job action sheets, which is a list of all of their roles and responsibilities, exactly what they're going to do to perform those roles. And as they're going through the lecture series, they get to eyeball this, and some of them say, "Oh, I can do that." Or,
Right,
I can
they
do
know
that.
where they fit.
Exactly.
Yes.
So in the beginning, we'll say to them, "Do we have any volunteers to take on these roles?" And a lot of times we get volunteers. And then from the volunteers, I might say to them, "Look, here's some job action sheets. Here's some vests," because again, we do everything in ICS, the Incident Command System, which is part of NIMS.
Which means you wear these vests.
Right, which actually has a label on it saying to what your role is. Whether you're
A safety specialist?
safety specialist.
Which is what?
Safety specialist is somebody either in a special needs shelter or a point of dispensing that looks for the overall safety of our workers in the actual setting. We make sure that if you're giving immunizations, that we have the red containers, that everybody has gloves, that nobody's overly fatigued, that there's no mental fatigue. That's a very, very important role.
Now I see the term grillage. If you look at that slide, you see grillage. What exactly is that?
Grillage is an interesting concept. It's a combination of greeting and triage, where somebody stands at the door, and we usually have a couple, depending on if it's a point of dispensing or a special needs shelter operation, to actually greet the people coming in and kind of an eyeball of a look-see to see, oh, is this person in distress? Are they not feeling well? And then we might pull them out of the line and maybe send them over to EMS.
Is that where the medical screener comes in?
No, the medical screener would be somebody that's not having any problems and that we're letting them go through the line, the point of dispensing. The medical screener is the position where they would look over the form that the client has filled out to see if there might be any contraindications to the medication that we're dispensing depending on the public health event.
Now, would these roles that we're describing differ in let's say, a special needs shelter as opposed to a regular shelter?
Yes. In a special needs shelter, we need a lot more people. We need nurses. We need people that are going to be able to do activities of daily living to help our clients to be able to care for themselves, because we're going to have medically fragile and we're going to have people that just need help with everyday activities of daily living.
Now, we talked a little bit about how people get assigned to these different roles and how that happens. You do these roles during the actual sort of training, but when the actual event comes, is that the role they will take on?
Some of them will. When we worked with Catholic Charities back in August, and they're going to be able to stand up this special needs shelter for us, they have assigned people to especially take on some of the command positions, some of the higher level positions that really took to this when we did the exercise. And a lot of times this comes out with the training and the exercise. That's why it is so important to be able to train and exercise with our community partners.
And that a lot of that comes out in the training or during the seminars, as you were saying. They figure out what positions they fit.
Correct.
And then
Correct.
They go for it.
But then in a lot of times, if it's a real event, you might have a lot of these people that have already been trained, but you also might have to do a lot of just-in-time training, because as you can see from our previous slides, the amount of personnel that's needed, that's when we put together the job action sheets, that when we put together the just-in-time training, where somebody comes in, we have a room set up, we give them their job action sheet.
Which are job action sheets? They're what, specific roles?
Specific roles, specific emergency response functional roles, whether it be a medical screener, whether it's going to be a triage officer, whether it's going to be dispenser. They all have job action sheets listed exactly what they're going to do in their role. And then we give them a little 20-minute orientation.
Can those job action sheets be found in other states? Was this something created just for Nassau County or just for New York, or?
It is found. It's found all over the country. But
just go online?
They can just go online. I know that the website at the University School of Public Health has them. I know that New York State Department of Health has them on their website. Or anybody can contact me. My information will be at the end of the presentation. I would be happy to share anything that we have done with anybody in the country.
And that's what makes so much sense, is it's already been created.
Yes.
You do the job, get it all together. And it is the University of Albany School of Public Health
Correct.
website, so you could go there right now if you did after the show, if you wanted these job action sheets. Who is best suited for these jobs? I mean, you have these volunteer firefighters coming in, you have police officers who probably help, you have the actual folks who work with special needs clients coming in. Is that how you know who's best suited?
That's a help. That
Yeah.
really gives us an edge up if we can get the community-based organizations that actually care for these clients. It really does help us. Like when we ran the special needs shelter back in August, we had the Hicksville Fire Department that actually came in and took on the EMS role. And we have asked them, because it's in the community, to be able to take on that EMS role in a real event when we have to open up a special needs shelter.
So most of them are volunteers, I'm assuming.
Yes, most of them are volunteers. And that's, again, it can be problematic. If you're talking about, say, a hurricane event where I have to open up a special needs shelter, a lot of them do have other jobs where they might have to be called to do other jobs. We are relying on volunteers. And that's why we have to have the buy-in on public health to be able to train and embrace our volunteers, that hopefully during an emergency they are going to come and help us.
And you need a wide variety of them, because some of them may have other jobs or may need to attend to their families.
Correct.
So you need a lot of them trained and ready to go.
Yes.
Tell us about the Medical Reserve Corps, because you depend a lot on them to show up on these days
Yes.
when you need them.
In Nassau County, we were one of the first counties to get the demonstration grant from the Surgeon General's office. And we have approximately about 420 Medical Reserve Corps in Nassau County, made up of licensed healthcare professionals or somebody with some type of a special skill set. Like we have a couple of attorneys, some hospital administrators, that would really be advantageous and really help us during a public health emergency. One of the big things that we've done with our Medical Reserve Corps is we've trained them. They participate with us. They just helped them. We just ran a couple of flu clinics in Nassau County. They participated in that. We just ran that really nice Medical Reserve Corps Symposium. And what was really nice with our Medical Reserve Corps Symposium, where NYSIPSI was really helped us collaborate that, was we did it by county. It was Nassau and Suffolk Medical Reserve Corps that we brought everybody together, which was really nice, the initiative of the bi-county.
Now you had all this training. How do you put this to the test? What do you do?
We exercise. We put together exercises where we might open up a point of dispensing. Back in June of 2006, we ran a large full-scale drill. We called it Operation Rapid, where we worked with our first responders and our first receivers. The first responders were our fire department, our police department. Our first receivers were all of our hospitals. We opened up 24 operational sites, including the S&S site and including points of dispensing, where everybody opened up simultaneously. We actually moved people through and tested the whole system. It was a great test of the system to know that we sort of have a turnkey operation, that we know that the hospitals and our first responders will be able to take care of themselves. But again, a lot of training took place before we were able to do that.
And was that part of NYSIPSI's role?
Yes. NYSIPSI helped us with all the training. VEEB, the EMS Academy, helped us with the training. What happened was NYSIPSI, along with Nassau County Department of Health, developed the training. We developed the slide set, and we developed the hands-on training. Then what we did was we handed it off to ViiV, the EMS Academy, who absolutely understands the first responders. And they in turn then took it out to the fire service and to the police departments and trained them how to do pod operations.
What other partners did you involve in this kind of training? I know you said police, fire, you had the hospitals.
The hospitals really did their own training. They did that through the Regional Resource Center, which is North Shore LIJ. They really coordinated the hospitals. Other partners in this were our towns. Town of Oyster Bay was the lead opening up the SNS site. We house our SNS site in one of their facilities.
The DOH?
The New York State Department of Health was a huge, huge help because they were able to get us the training pack for the Strategic National Stockpile. We actually bought the training pack for the Strategic National Stockpile, actually broke it down, sent it out, and then from that point we were able to open up the points of dispensing. We also, the New York State Medical Society, for this exercise, we activated the call down through the New York State Medical Society to see if any other licensed healthcare professionals would be able to respond to Nassau County in an emergency. So we got a little bit of data on who could respond, the time frame, and this was throughout the state. So that was another interesting partnership.
Which of these partners have proven most effective?
All of them.
It's just vital to have them all. They've all been effective.
They've all been effective. Everybody comes to the table and brings their resources. Honest and truthfully, you need to have everybody to the table. I cannot really say that one is more important than the other in the community partners.
How about when it comes to special needs cases?
Well, that's a little bit of a different story. In the special needs, I really look to our community-based organizations that partner with our special needs. Back in March of last year, we did the training in February, but in March we ran a special needs point of dispensing exercise with AHRC, which is the Association for the Help of Retarded Children. It's actually an agency, and that's their sole business, is to take care of these special needs clients. They have about 3,000 clients that they take care of on a day-to-day basis. So we worked with them to be able to set up a point of dispensing actually in their school up in Brookville. One of the things that we looked at was they are really the specialists in taking care of these people. And they have the know-how and the wherewithal to be able to deal with this. But they also are going to be able to prophylax their clients' families, their teachers' families, plus they also have homes in the communities that they will also be able to prophylax, encompassing about 12,000 people in the community, which is a significant part of the community.
What were the invaluable lessons that came from that drill? It sounds like realizing that they're the best ones qualified to work with this population.
Absolutely, absolutely. Higher acuity requires assistance through the point of dispensing. What we really learned was we needed more flow controllers. You know, flow controllers really controls how the flow is going through the point of dispensing. When these clients came through the pod, some of them got upset from the loud noises, and it was really out of their daily routine, and this was a concern. But because we had the people there that deal with these clients on a day-to-day basis, they were able to comfort them. They were able to walk them through the pod in just such a better way than we would have, or if we put them into a general population pod. It was just really showed that the need to be able to reach out to these clients.
Would that kind of training work for other kinds of special needs situations other than AHRC?
Yes. Any type of special needs populations. Again, we're working with Catholic Charities. They have a large senior population. They have a large Meals on Wheels population. And working with them, we have also set up points of dispensing with Catholic Charities that they will be able to take care of their own clients.
That's a great way to do it. If you could think about it, what is the most important lesson learned from that experience? Special needs pods.
That we need to do more. I really, we reached out to AHRC, we've got Catholic Charities on board, but there's even more special needs populations. And also, too, with the special needs populations, working with the agencies that work with the special needs population to teach them also how to do personal preparedness for them, how to get them prepared. Perfect example, in the special needs sheltering. We go out and we train with our senior citizens, with AHRC, with other special needs populations, and we teach them personal preparedness before we even get to teach them special needs shelter operations, because we want them to be able to be personally prepared. Because honestly, if we can get our special needs populations prepared personally and they don't end up in one of our special needs shelters, I really feel we've done our job. Because we want them to think about, if a hurricane is coming and they need to evacuate, I would rather them make arrangements, or their
ahead of time.
Right, or their caretakers make arrangements for them to go with a family that's in the middle of the island, on the spine of the island, rather than come to our special needs shelter. I always say a shelter is a lifeboat, not a cruise ship.
That's a great way to look at it. You do surveys after all of these too.
Yes.
And what was the biggest surprise
Yes.
that came from the surveys in this case?
We do surveys after our training, and that's where NYSIPSI, University of Kansas at Wichita, really puts together the surveys to find out how well we're doing training our partners. What do we need to do?
Well, you got some results here. 60% of the staff, when actually most of them were very positive, and
Yes.
the 80% reported, 96% of the staff completing the survey agreed or strongly agreed that they can explain the general process flow of a pod. Those are great numbers. 100% of the staff agreed or strongly agreed that they understood how their pod will be activated. And then 93% of staff agreed or strongly agreed that they can describe how pod operations function. And I think that just shows that that training really paid off.
Absolutely. And that's what we look to that, because then we look to say, do we have to tweak the training? Was the delivery wrong? Did we not cover enough of the operation? So we really rely on these surveys to help us train better. One of the things that you've noted here, 60% of the staff reported appropriate supplies were always
The
provided.
next staff, there we go, the next
Right.
slide, there we go.
That is something that, when we come in as DOH, we give them a list when we work with our point of dispensing partners, and we say, this is probably a list that you might consider having on hand: pens, paper clips, regular supplies. So we noticed here that we need to work with some of our special needs pods to be able to have better supplies.
That was the one thing that really needed to come out of that. How many people, though, actually participated in this and then took this survey?
We had about
44?
About 44.
Yeah.
And I would say probably about 85% of them filled out the survey.
So it was a good number of response.
A good number of response. What we try to do is we try to sort of stand at the door once the exercise is over to make sure that they complete the survey, and we tell them how important the survey is for us and the feedback, whether we did a good job.
That's great. We talked a little bit about who staffs some of these special needs shelters. You prefer finding the clientele that actually works with the special needs population, but who else is staffing?
Any community-based partner we can find. There's so many different roles in special needs shelter operations. I mean, we have our flow controllers. We could take college students that want to just come in just to help with activities of daily living. We might have elder clients that we just might need to walk to the bathroom. So there's some jobs that we really can fill in with anybody. We have the registration desk at our special needs shelter where can be filled out with anybody, but we're going to intake the information on our clients coming in. So if you're willing to volunteer, we have a position for you.
And the training is key for those people who are willing to volunteer. And do
Yes.
you consider these trainings, now that you've done several of them over the past year, effective?
Yes, but they need to keep happening.
Are you looking at an annual basis, every 3 months?
More. What
More.
we're looking at, we had signed the MOU with Catholic Charities, the Diocese of Rockville Center.
What
for
is an MOU?
A mutual order of understanding, where we agree to help each other. And that this way we got the facility, the Holy Trinity Diocesan High School, where we ran this special needs shelter. We also recently got another MOU for Kellenberg High School, which is in the community of Uniondale. So one of our plans for the springtime is to go out to the community of Uniondale, like I did in Hicksville, to get them to adopt this, to get them to help me man this shelter in Uniondale.
This is very time consuming on your part, and certainly anybody else who's trying to coordinate. For folks out there who would like to get this started, where do they start? Do they start with these MOUs?
No, the first thing you have to start is by joining your community-based organizations. Like in Nassau County, we have an organization called VOAD, Volunteer Organizations Active in Disaster, where a lot of the community-based organizations come together to bring their resources, talk about their resources, and what they would be able to do in some type of a disaster. That's how I first got introduced to our community-based organizations. And then I was kind of, when you go, you're kind of listening and assessing. And then you're thinking, oh, that organization might be really helpful to us in dealing with special needs population. That's where I met Catholic Charities. That's where I met AHRC. So I met them at VOAD. And then by getting involved in the community, I was introduced to more community partners. And
so it sort of just blossomed from there.
It sort of just blossomed. But I said to them, you partner with me and I'll train you. Therefore, you're going to also protect your clients in your community, but you're also helping me in public health. So it was a good collaboration.
Now, a lot of words flying around that some people may not. VOAD. Tell me exactly what that is for people who may not be aware of it.
VOAD, Volunteer Organizations Active in Disaster, is community-based organizations that come together to assist in some type of a disaster. Again, Catholic Charities is part, AHRC is part.
Why Catholic Charities? What makes them so?
Well, they take care of a lot of the vulnerable population, the senior population. They have a lot of senior housing. They have a lot of social service programs. So they're very good, too, at going out into the community and reaching the vulnerable population. American Red Cross is part of VOAD. United Way is part of VOAD. Salvation Army is part of VOAD. So these are all service-based, community-based agencies that really know the community, and they were able to help us.
Is that the best way to facilitate? Let's say you want to partner with Catholic Charities. Is the best way of facilitating that partnership going directly to them or going through an organization like VOAD?
I went directly to them. What happened was when I went to VOAD and I was introduced to all these different agencies, and I went to a couple of meetings. I was the new kid on the block when I first started. And then we exchanged a lot of business cards at these meetings, so we got to know each other. And then I reached out and I called Catholic Charities and we called AHRC, and I said, you know what, can we talk about emergency preparedness? Can we talk about what we can do collaboratively together to help your community and in turn help public health? And that's how the relationship started growing.
And is that how, remind us again how you start to then organize these massive numbers of volunteers? What kind of communication has to happen and how you get that ball rolling?
What we have is a database of all of our special needs community groups, our community organizations at large. And whenever we have some type of an event, okay, when we ran the symposium back in November for the Medical Reserve Corps, even though it was a symposium for our Medical Reserve Corps, I invited all our community-based partners to it so that they were able to share in all of this educational experience that we were able to put on. So that again was showing good faith on my part that I value you, and I'm also inviting you to our Medical Reserve Corps symposium. We go out with emails, telephones. We also have an emergency alert notification system in Nassau County, which is operated through our Office of Emergency Management, that if there was some type of an emergency, I would be able to call down all of our partners and tell them exactly what they need to do, whether we have a number that they need to call in, if they can volunteer, if any of their agency can help me out. So we have all of that plan in place to be able to access all of our resources.
And that takes a matter of minutes?
Minutes.
Minutes to get those calls out.
It's longer to put the voicemail into the system and to type the email than it is because it's already in the system. It's an Excel database that we put into the system that's able to go out to all of the contact numbers that we have on file.
All right, let's talk about, you get all these volunteers, you've got the communication out there, you've got the shelter set up. Now, what are the stations that are involved in a special needs shelter drill or even actual event?
Well, when people come in, they come in first and they come into the grillage. They walk into the lobby of the school. We have our triage doing our little look-see. Is there anybody that's in distress? Do we need to get a wheelchair for somebody? Somebody that needs a little help. Then we move on to registration. At registration, we take all of the pertinent information from our clients. We try to find out if there are any caretakers with them, who's going to stay with them, what do they need, what kind of services that they're going to need. From there, they'll go on to the nurse's station, where they'll do a medical assessment, where we might see what kind of medications that they need, what kind of medications did they bring with them. Do they need regular bandage changes? What are their medical needs? And then also, too, we have EMS that's there. And EMS is there if we have any problems, if we have any type of clients that need to go to a more of acute care setting. If we need to have a client that needs to go to a hospital, or if somebody falls and hurts themselves, EMS is there then to move them on to a more of acute care setting.
And then if they're going to stay in what is a sleeping area.
Correct.
How do you staff that, and how do you get that set up?
That was very interesting. When we first set this up, now this was our first time out of the box doing this. So we got together the Saturday before we ran this drill, and we all kind of stood around looking at each other. We had all of these cots and we had all of the supplies that we needed to set it up. And then we said to ourselves, okay, we think we know how to do this, but we had such a great resource amongst us. Mary Mahoney, who is part of the North Shore LIJ Health System, which is our regional resource center.
Which is Long Island?
Which is Long Island. And we have regional resource centers throughout New York. That's the hospital that's designated in the area to work with the health department and to work with the other hospitals in public health emergency preparedness, We had the good fortune, Mary was down at Katrina. Mary is also part of DMAT, which is the Disaster Medical Assistant Team that was down in Katrina that actually ran special needs shelters in Katrina. Plus, she had also been down in Florida when Florida had some hurricanes. So we had firsthand experience. She came in, she worked with us, she helped us set up this whole sleeping area.
What did you learn from her?
A lot.
A lot?
We learned that, first of all, we never thought about numbering the cots. Ooh, okay, we need to number the cots. We numbered the cots, and then you need to number the clients with the cots. Then you needed a big sheet with the cots, with the name of the client. It just helped us so much. We did go back and revamp our plan a little bit, but she was just such a godsend to us in helping us set this up.
And you mentioned she's from one of your regional resource centers. Are those available throughout the country, or is this unique to Nassau and Long Island?
I think it's just unique to New York and Long Island, but I could be wrong. I'm just really familiar with how New York runs, and we really utilize the regional resource centers, and I don't know if that's unique to New York.
But they are so effective and necessary, you think?
Oh, absolutely.
Yeah.
There's such a collaborative partnership working with them and working with the hospitals.
So very important. What were the strengths and weaknesses that came from the results of this actual drill, where you had the sleep area set up, you had the EMS? We did a survey, I believe.
Yes, we did a survey.
Let's take a look at that.
We did a survey. We did a survey on the training. Did they feel that the training was effective, that they were able then to go and exercise what they had just learned? And 100% of the staff responding to the survey reported the ability to describe the objectives of the medical and functional special needs shelter and explain what makes an individual of a population of special need, like what makes a person a special need. So they were able to describe that. 91% reported that they can listen and explain 5 emergency response functional roles of the special needs shelter. In other words, they can at least name 5 of the roles and what they do and how to act in them, which is important.
Yes, very good. And 91% again. Did you have a large number responding to this survey as well from this number of staffing?
Yes. We had about 140. We had about at least 115 respondents that came through.
Pretty good. That's
yes.
a pretty good response. This is really strong feedback when you get that kind of numbers going. Does the 82% of, and that's on the next slide, I think we want
Right.
to show that results with special needs exercising. Does that 82%, which is one of the lowest that you
Right.
got in this particular case, show you what you need to improve on?
Yes. On the 82% reported that clients were triaged, assessed, and registered efficiently. We saw in our triage that we had let the junior firefighters take on the triage role. And we really feel that we probably need somebody in that role that's probably a little bit more seasoned.
For the special needs.
For the special needs. Because again, they're clients with higher acuity and probably need a lot more help. That we saw that was a weak point. So we will definitely look to put people in those roles that have just maybe a little bit more experience and can do it a little bit faster. You know, if we're opening up a special needs shelter and we're having a lot of clients coming through, we need somebody that's going to be able to spot, especially somebody in distress, somebody that would need EMS rather than going into a special needs shelter. We're going to need to be able to do that in a rapid fashion.
Now that brings up a huge issue, which is liability. You have all of these volunteers, some of them junior firefighters in different positions. Are you worried about that? What is the liability?
Let me tell you how the liability works, what we've done. When the community-based organizations come to us and work with us, it's a mutual collaboration, like for instance, Catholic Charities. They're taking care of their clients, plus they're also helping us. So they're really working within their own community-based organization. The same thing with the fire department. When the fire department comes to us and works with us, they're working within their own community-based organization. Two things that are different are our Medical Reserve Corps and our community emergency response teams. That liability is covered under Nassau County. Under Nassau County, we have the administrative code, which covers their liability because that is actually a Nassau County run organization.
Well, let's say it's an actual emergency. You've got volunteers coming out of the woodwork, people you don't necessarily know, coming in off the street, they want to help. How does that play out?
We're working right now, again, through VOAD, Volunteer Organizations Active in Disaster, to be able to set up an unaffiliated volunteer center where people would come in during some type of a disaster, and we would train them and be able to put them in the appropriate organization that they would work with during the disaster. We would not look to just have people walking in randomly, but we're going to look to set up a volunteer type of a station, which would be processed through the county, working with the VOAD, the Volunteer Organizations Active in Disaster, and all of our other community-based organizations.
So there are places that they will probably be able to go or not.
Right. But the best is, let's get you on board before the disaster.
Right, right.
That's the ideal situation.
So that you'll have a place to go and you'll know what you need to do. Just recruit them.
Correct. This way we don't have those, what we call SUVs, spontaneous, unaffiliated volunteers.
And then one of those places that they can join is that Medical Reserve Corps, which has made a huge difference in your collaboration. Let's look at them a little bit and talk about that organization.
The Medical Reserve Corps has been such an asset to us in helping us with public health initiatives and helping us in disaster preparedness. What we look in the Medical Reserve Corps, we're looking at getting licensed healthcare professionals. We're looking at retired licensed healthcare professionals. We're looking for people that don't have to be at the hospital during a disaster, maybe practitioners that are out in the community. What I don't want to do is I don't want to pull away from our hospitals. So that's really important to me, to be able to go out into the community and get our practitioners, get our retired licensed healthcare professionals. And another organization that we've collaborated with that's worked so well is we've collaborated with NYCOM, which is the New York College of Osteopathic Medicine down on the island. And they're going to be able to open up a point of dispensing for us, which again will be a turnkey operation using their staff, which is all licensed healthcare physicians, and their students, which has been wonderful. Back, I think it was 2003, we ran an exercise with them where they actually did staff the whole point of dispensing. So again, that's another partnership, not just with community, but with education-based.
Now, you've got such passion for this. We can see that. And it takes that kind of passion and energy to go out and recruit all these agencies to keep the momentum going and to find them. For somebody who is out there who wants to do this, they have to find a way to keep the momentum going, and they have to find these groups and get them involved.
Yes, and it's not easy. It's a lot of work. It really is. It means going out to a lot of meetings.
That's the first step?
That's the first step. You have to join. You have to participate. And you know, public health sometimes is not good at reaching out to the community-based organizations because we didn't have to do it a lot, especially before emergency preparedness came along. So now it's sort of a new realm, but it's just, I feel that I've been blessed working with all of these community-based organizations because I've learned a lot. I've learned what kind of resources are out in the community, what we can use to help the communities. Because sometimes it frightens me. I look at Nassau County, 1.3 million people, and we have 342 public health staff in our department. How could we do it alone?
Well, and that brings up a good point. What is your role? It sounds like you're a jack of all trades and in charge of so many things, but what is your specific role?
I do public health emergency preparedness for Nassau County Department of Health. That's my only role that I do. So I really try to collaborate. I try to work with the organizations. I work with the Office of Emergency Management. I work with the police department. I work with the fire departments. We plan together. We train together, and we exercise together.
So you are the key that brings them all together. Do other states, other counties have somebody in your position?
Yes. A lot of other counties have people in my position, and we were able to do that through a lot of the funding that we've gotten from CDC through the pass-through the New York State Department of Health to be able to give us the finances to be able to do this. Unfortunately,
I was going to say, are you worried about that?
Yes, I'm very concerned about it. It's, the funds are dwindling. We did get a cut this year, and I'm sure we're going to get a cut next year. So it does concern me because I've really reached out to the community, and I think that there's a trust and a bond between community-based organizations and public health. And if these funds are cut, what am I going to have to cut? Am I going to have to cut some of the education and training that I do with these community-based organizations, the exercise that I do with them? And then you're going to lose that buy-in. So I am very concerned about what could happen in the future.
And you're going to lose that momentum.
Yes.
And then you have a real hard time when the actual emergency happens.
I agree.
If you don't have it
Yes.
all going. Let's talk about reaching into those communities in particular, especially if you're not going to have the funding to keep the drills going. How do you reach into those communities and just keep grabbing them and keep getting them and finding them?
You're going to have to rely on your community-based organizations to help you.
By giving speeches or by
We
showing
go
up for buffets, or what do you do to get them going?
All of the above.
Yeah,
All
okay.
of the above. What we do is we participate. You have to go to the meetings. You have to be able to. We go out and we do public health emergency preparedness PowerPoints. We go out to the senior citizens. We've gone out to the Catholic Charities meetings. We've gone out to our village officials meetings.
Are they happy to see you, by the way?
Yes.
They're all receptive?
All receptive.
They're glad you're there.
Very glad that we're there. In fact, a lot of them that we haven't touched and say, wow, you've brought some good, interesting things to light, and you've really helped us think about things. And a lot of it, too, is on personal preparedness. Because if we can get people to be able to be personally prepared, it's going to make our job in public health so much easier.
I'm wondering if there was a lot of interest after 9/11. There's certainly interest when things like Hurricane Katrina happen or earthquakes, but if you go far enough away from that actual point of impact, do you start to lose that interest until another disaster comes along?
Yes. And unfortunately...
Short memories?
Short memories. And Americans do have short memories.
Yes.
And the further and further we get away from any type of a man-made or a natural disaster, people don't think about it. Oh, it can't happen here. And, I live on Long Island. For the past couple of years, they've been saying, oh, it's going to be a very bad hurricane season. You better get prepared. And we haven't had any. So now everybody says, oh, nothing's going to happen. So it makes our job a little bit harder to get them to be prepared.
Sure it does. With your years of experience, though, what are some of the things that have surprised you? Is it the fact that people get lazy about it and forget? I mean, there was such a fear after the anthrax scare. There's a fear of biological terrorism, and then that dies down. What most has surprised you about this business that you're in?
You know what's happening? People have so many other priorities that they don't think about disaster preparedness. I mean, just look at our vulnerable populations. We have people that just worry about feeding their family or making their day-to-day bills or getting to work. And then I come in and I talk about disaster preparedness, and
they're overwhelmed.
They're overwhelmed.
Yes.
Like, how do you expect me to do this? Or when I talk about getting together a supply of food and making sure that you have all of your personal papers together, putting them in a Ziploc bag to make sure that they're safe, and having them all in an area where if you have to leave your home, that you can be able to grab everything. And
they can't even fathom it.
They can't even fathom that. So that's another avenue that is really concerning. Like, what can we do to help them? I mean,
Short of going in and doing it for them.
right.
Yeah.
Again, it's the education. It's trying to help them. Putting things down on paper. I know with our Medical Reserve Corps, what we've done is we've given them all go bags. Emergency preparedness go bags with lists on what to do, how to get prepared, because again, we want our Medical Reserve Corps to be able to be prepared to be able to grab that bag when we call and go.
Right, at the very least you need your volunteers to be ready.
Yes.
At the very least.
Yes.
Is there, do you do any kind of like public service announcements, or what do you do to sort of keep this in the public eye when there is really not anything pressing?
Especially during hurricane season, we go out, we partner with Office of Emergency Management, and we work with the community-based organizations to go out and do our annual hurricane update, our annual emergency preparedness, talking to the community-based organizations how to get prepared. We come with our handouts, we come with all of our literature, this is what you need to do, canned goods, water. Every year we do it. It's cyclic and we do it every year, and I'm very happy to do it. And you know what's really great is if you see the same people there and say, you know what? I did get all of that food together. I have all of my important papers in a bag.
Feel so much better.
I do. I said, wow, somebody listened to me.
Right. Right, it must feel good. But you probably have to hit a lot of those events every year at the same time. It's a whole nother crowd you're going to have to hit.
You do.
Yeah.
And we dedicate the time. And I have some wonderful staff that work with me. I have 3 public health nurses that work with me, plus clerical support, plus a great administration in the Nassau County Department of Health that support me, that allow me to go out into the community to be able to do this.
Why do you think some of the funding is being cut? Do you think it's because the government or the politicians who are cutting it may think we're ready?
I think maybe we're partly ready, but we're not there yet. But I do think that, you know, we have other initiatives that the politicians might feel need the money
important?
more than public health.
Is that also a short memory sort of situation, do you
Yes.
think? Yeah.
I really do agree. Remember after 9/11 when all of the money got pumped in, and when we did smallpox, we had an initiative to pump money in on smallpox. The same thing with pandemic flu. We had an influx of money with pandemic flu, and now it's all sort of, you know, falling off.
Now, before we go to the questions, which we're going to get to, what's the message, the overall message that you would love for your audience to take away from today?
Know your resources in your area. Partner with all of your community-based organizations because you're going to need them. They need you, but you need them. And I think that you need them more because you need them to get to the community. Because especially, perfect example is if you have populations in the community that are non-English speaking and you need to reach out to them to make sure that they get the message, being able to partner with those organizations that are able to access that part of the community is very important. Otherwise, your message is not going to get to them. How are they going to get protected?
How are they? Well, let's talk about then real quickly for one last time so we can sort of sum this up. For the community-based organizations then, obviously, you need to be a great diplomat, a wonderful negotiator. You need to be out there pulling them in.
Yes.
And that's going to be the main job of anybody out there who wants to do this.
Right. And to put together, even if, say you want to get out in the beginning and your resources are limited, and one suggestion that I have is try to find a mailing list of all of the community-based organizations in your area. Put together some type of a breakfast. You know, come meet public health. Something just to get into these community-based organizations. It could be something as simple as that. Then you could give them an overview of what public health is. And believe it or not, a lot of community-based organizations have no idea what public health is about.
Don't have a clue.
Don't have a clue what public health is about.
Okay. Do you put some suggestions on there just to get their eyes open?
Just to get your eyes open, and also to give them an education on what public health is about. You know, public health is it's sort of the silent protector. You know, we go every day going about our mission, but we're not really good at marketing what public health does.
So, yeah, and it's very important that you do that. And you market what the cooperation is the key, and I think you've said that several times. The cooperation between all agencies, the partnerships and planning, individual responsibility, all of that has made public health preparedness in Nassau County, and I imagine across the country when it happens the way it's happening in your area, a huge success when it happens. Yeah.
Absolutely. Again, training, exercising, collaboration is really important. You know, spend the few dollars, put together a little breakfast. It's not that expensive. Invite all of your community-based organizations in. You could do it as Meet Public Health.
And make sure you have food.
Yes, food is important.
Food is important. Have a little budget set aside.
Yes, food is important.
Okay.
And yes, you do need the food.
Okay. Well, let's take some calls now. I know people out there might have some ideas. So we're ready to take them. The toll-free number is 1-800-452-0662, or you may send your written questions by fax to 518-426-0696, or to the email address that's right on the screen below you. You can see it there. Our first caller. Oh, we have an email question first. It's from Nebraska. Okay. Does the county cover workman's comp for the volunteers?
Yes, under the Nassau County Administrative Code, because they are considered, under the Nassau County Administrative Code, a volunteer for Nassau County is considered an employee.
Okay, that's a great question, and it's good to know because I'm sure that's part of the liability issue.
Yes, and I have to tell you, we are fortunate. We are very fortunate that we have a government in Nassau County that has been so proactive with volunteers and willing to do this and just stepped right up to the plate. Because I know there's a lot of avenues out in the country that this is a huge problem, the liability with their volunteers.
Well, I was going to say, a lot of governments then may not have this kind of situation where they're willing to cover any volunteer, and what happens?
A lot of governments are facing
You sign a waiver when you get on board,
Yes.
sort of. Okay. All right, we have another email. Could you define what makes up special needs? This is a definition we struggle with and find varies from community to community.
And I totally agree, and we struggle with it every day. In the National Incident Management System, in the new plan, there is a new, and you can get that off of FEMA's website, there is a new definition of special needs. But I got to tell you how we're defining special needs in Nassau County. Anybody that cannot function in a general shelter.
Anybody that cannot function in a general shelter. What would FEMA say, do you know?
There's a couple of pages from FEMA that really goes into classifications and really some tight definitions.
But who has time for that in an emergency necessarily?
Right.
Your idea is, look.
Right, and that's why we partner with Red Cross, because Red Cross mans the general shelters. And again, they have a triage system. And if they come to the Red Cross shelter, one of our special needs, and they can't adequately take care of themselves in a general shelter, they are going to be sent to us in the special needs shelter.
So then you know right then and there it's going to be that situation. Okay, that's great. Do we have another question? I think while we're waiting for some, let's talk a little bit more about, that's why when you do your drills, you do them mostly with special needs pods.
Well, we do special needs pods, but we've done a lot of general pods.
You've done those as well, okay.
Right.
But you know that Red Cross is going to be taking care of a lot of the general population. I've got a few
on
more
the
that came
shelters.
in. On the shelters, yes. And then, okay, let's talk about, here's one that just came in. In the state of New York, is the state of New York involved or aware in this effort at all, or is it just driven at Nassau County?
The effort for special needs shelter?
I think they're talking about, in general, this public health coordination that you have done to do the training and to provide the shelters.
I know I think it's unique to Nassau County. I know that some of the other counties, when we get together, have done a lot of training. I know that...
Does the state help you in any way?
Yes. The state is there as supportive. Anything that we need, any resources. I used to work very closely with Leah Madison, who used to be from the New York State Department of Health. She was instrumental in helping me a lot with my special needs sheltering.
So it's a support.
Yeah, it's a support and a resource.
And a wonderful resource, of course. Okay. Now, how can our audience access training materials and resources? This is the CPHP website. They're wondering how their audience can access training materials and resources.
You can go to NYSIPSI.
Okay.
They have,
and we're going to show, I believe, a website for that at the end.
Great.
Yeah.
They are another great training resource. You have the Albany School of Public Health, their website.
They can call you, you said?
Absolutely.
Yes.
At the end of the presentation, they'll have my email and my phone, and they can call me, and anything that I can share with them, I would be more than happy to share.
And a lot of the forms we can find online, we can direct them to that as well.
Correct.
So there's a lot of ways.
And I know that NYSIPSI, because we work with NYSIPSI, has point of dispensing training online. And I know that they're working right now, because they work with us with our special needs shelter, that they're getting ready to put together a special needs shelter training online too.
So they can check in with that.
Yes.
Let's go to a call from Kansas right now. We have a call from Kansas. You're on.
I'm wondering what they put in the go bags for the MRC volunteers.
What are in the go bags?
We put in the go bags, we put in a plastic bag. I'm going to try to remember everything that's in these go bags. I'm sure that I'm going to miss some of it. We put in a huge container, a collapsible plastic container that you would be able to fill with water. We put in a plastic envelope that they would be able to put all of their personal papers in. We put together like a mini utensils type kit, flashlight, a battery powered radio, a whistle. I'm trying to remember all of the, we put in a poncho. We put in a little, like a Kevlar type suit. We put in an N95 mask. We put in an MRE. That's food, that's dried food that you can use during an emergency. We put in a little mini toothbrush, some toothpaste, and then we also made suggestions that they need to also make it their own, what they would need. Like when we ask a Medical Reserve Corps person to come to us, like, do they need to bring their own medications? Do they have special things that's their own that they need to bring?
Now, a lot of this information that you may be looking for out there, the Center for Public Health Preparedness has a lot of this information on their website.
Yes.
So just go there, you can call them, you can get a lot of this information. Even some of the forms may already be pre-prepared there.
Absolutely. So. And they have a list, too, on that site of things to put in a go bag.
Yeah, oh, great, great. Now, how many staff members, we're going to talk about online resources in just a second, but first we have another email. How many staff members in your department work on emergency preparedness?
There are myself, 3 public health nurses right now dedicated, and I have clerical support. But that's just doing the initiative that we're doing, reaching out to the communities and working. But I'm going to tell you that almost the whole department works on public health emergency preparedness, because it's vast.
Which is 300 people in your?
342.
Okay.
They all have other jobs that they do, but in any type of an emergency or disaster, they would all be working in public health emergency preparedness. We have our environmental division that really works on a day-to-day, functions on a day-to-day operation, and looking at our water, looking at our food. I mean, this is a day-to-day operation for them. We have our Division of Disease Control that every day looks to prevent diseases, investigate diseases. So it's going to be sort of ramped up, but we're going to need all of those skills that our department does in any type of an emergency or a disaster.
Now, you've mentioned that you've worked with a lot of people around the country, not just in Nassau County, to sort of make this happen.
Yes.
Do you want to acknowledge some of them?
I've worked with, Elizabeth Ablar, Dr. Elizabeth Ablar out in the University of Kansas.
Christine Gebbe has been a big help.
Oh, Dr. Gebbe has been a godsend to me from the Columbia University School of Nursing, Vocational Education and Extension Board, which is part of NYSIPSI, their EMS division, who has been great too. They've helped us with the training, and they also work with Dr. Gebbe and Dr. Abla. Eileen Verity, who is an attorney that works with Catholic Charities, who's been the lead in helping us coordinate Catholic Charities. And again, Mary Mahoney from the Regional Resource Center, that's been another resource to us.
Wow. Now, you said people could call you.
Yes.
If they have any information, or if they have any questions. Do we have a number or a website? Are we going to put that? There it is, right?
Okay.
Oh, no, that's the number for folks to call in.
All
this
right.
is the website, Eileen.Scanlon. And there is the phone number. Write it down, and she would be happy to answer your calls when she gets back to Nassau County.
Yes. And I would be happy to share anything that we've done to make anybody's job a little bit easier.
Well, and that's great because that is what this is about, is cooperation, and you just seem to be at the top of your game in that department. Here's one more question. In Northwest Georgia, we have a really good local emergency response committee who have been working together for a couple of years on emergency preparedness. We have completed full-scale exercises with really good results. Our problems continue to be twofold. One is law enforcement and having adequate security at multiple PODs when needed. How do you handle this? We got about 2 minutes, and the other is volunteers. Not a problem when we discuss regular emergencies, but when we discuss the pan flu, volunteers are concerned. They don't always show out.
Absolutely, and that's a concern that I have too with pan flu, because people are going to be afraid for their own safety.
Right.
And we're looking at doing some modifications on our point of dispensing, where, say, we put together a drive-through point of dispensing where we wouldn't need as much staff, and also too, you wouldn't have the exposure. People would stay in their cars if we need to give them antivirals or some type of a flu vaccine when it's developed.
Drive-through, that's a great idea for dispensing. How
So-
about the law enforcement? How do you handle that?
The law enforcement is, first of all, you need to partner with them the best you can, but you need to look at what other resources you have in your area. Do you have a correctional facility? Do you have fire marshals? What other kind of law enforcement do you have in the area? Not just your police department, because I do agree that they're going to be busy, and that's what we've done. We're working with multiple different agencies, and we also have other police departments in villages and in towns that we were able to also gain access to. But again, you have to realize that they're also going to be out doing their regular, normal job as a police officer on a data act.
So if you can find the retired folks from the retired police union or the retired fire marshals, those
Correct.
are great.
Those are really great. And we also, you have a lot of organizations that have the retired police officers. Access them.
Yes, go right to them. That's wonderful. Thank you so much, Eileen. You have been a wonderful source of information, I know, for me and for so many folks out there. We really appreciate it. We encourage you all to contact her. That's why she came. She wants to get that information out to you. She can lead you to lots of different online resources and other phone numbers and places you need help, so please do that.
Thank
all right.
you.
Thank you. Well, thank you for joining us today. We would like to ask that you please fill out your online evaluation. Your feedback, very helpful in planning future programs. And continuing education credits are available after completing the post-test. This program will be available online within a week or so. Please check our website for details. I'm Elisa Streeter. We'll see you next time on the University at Albany's Center for Public Health Preparedness Grand Round Series.